Often I think about what would happen to our patients if we weren't here.
I didn't realize till I was put in this position of not being able to afford insurance or health care. I didn't realize how many people are in this same position. And I mean from all walks of life. And it's all good people. They just need their help so badly.
Well, the safety net clinics provide a much needed service, and they fill a big gap in the community. There are a lot of people who just don't have access to health care. That's people who don't have insurance, but it's even some people who do have insurance, in particular Medicaid. If you've never been on Medicaid and you think that having a medical card equals having access to health care, then you should be on Medicaid, because it doesn't equal having access to health care. The people that need health care the most have the hardest time getting it, and that's where safety net clinics come in.
We see patients that are low income, but it's not who you would think. I have patients who have master's degrees, I have patients who have PhD, I have an architect who can't find work that I've seen for the last couple of years. It's also patients who have just lived in poverty their whole entire life, don't really have an education, work at McDonald's or fast food. Our education level, our patient level range is huge.
Patients treat us as their medical home. They're not scared to come in. They know they're not going to get a big bill. They're comfortable seeing us. We have a wellness program, so they're able to join a walking group and do all of those things that they need to do to keep healthy. And I think that makes a huge difference. When they have the resources they need, it makes a huge difference in how they take care of themselves.
It keeps patients out of the ER, it keeps patients from being admitted. Our goal is to keep patients at home and to keep them healthy.
I wanted my work to, really impact the community. I wanted to really impact the health of the community so the community can function better and be a healthier community. I also get a lot of satisfaction out of working with the patients. They are so appreciative of the work we do for them.
This makes me feel really good about all the people that help make this place possible, and it makes me want to help out my community in some way as well. It makes me want to do more for my community because my community is supporting me, and I appreciate that.
And I just remember one patient, she hadn't had care in about 10 years, and she was very reluctant to take medication, both for the price of the medication and just because she was a little fearful of it. So we talked for a while about how we can help her afford that medication and some of the side effects that she might or might not expect. And I just took my time with her, and she just looked me in the eye at the end and she goes, "Why do you care about me?" She goes, "Nobody cares about me." And it was really just a pivotal moment in the work that I was doing in the clinic. Just to hear that she hadn't really connected with someone who cared about her. So I think that it's very satisfying to have, to know that you have that role in someone's life.
The demand side is going to grow, probably exponentially in the next several years. Unfortunately, the supply side is not there to meet all of that demand. So there's going to be, from an opportunity standpoint, I think there's going to be opportunities for growth, and because there's certainly going to be a demand for it.
The salary that we would offer is pretty comparable to what a student could expect to receive their first several years out in private practice as an associate. And then one of the great benefits is the access to the state loan repayment programs that they would not be able to access if they were in private practice.
Loan repayment is always a nice thing when you're getting out of school and you're looking at the debt that you have and thinking how you're going to pay that off, and committing 2 years really goes by so fast, and what you get for it, and just the joy of working here too. I don't see myself working anywhere else for a long time. I like that I can focus mainly on the dentistry and the patient and not be concerned about the business side. That never really intrigued me, owning my own practice or even just the whole business aspect of things. Dentistry has its own challenges, you know, on its own, and being able just to focus that, I feel like you get better relationship with the patients, and it's just more of a honest relationship from them and myself.
I can go somewhere else and make more money, but for me and the people that I work with, it isn't about the money. The insurance part doesn't matter. The social economics of how they live doesn't matter. We just want to give them the services that are available to them at a cost that they can afford.
You can go into medicine to make money. There's a lot of money to be made in medicine. Or you can go into medicine to make a difference. This kind of medicine makes a difference.